Yeah, so if you study pharmacology in nursing school without using the prototype method, you're definitely wasting time and energy. It still shocks me every day how many nursing students have never heard of the prototype method, even though a lot of pharmacology textbooks are actually written with the prototype method in mind. You should check your textbook to see if your textbook is one of them. But here's how the prototype method helps you with nursing pharmacology. First off, you don't have to know every detail about every single medication used in order to be a safe, effective beginning nurse. Experienced nurses don't even know that. They might come to learn that about their specialty area medications, but not all medications. So you don't have to get to that level of detail in nursing school. What you do need to know is you need to know the generalities. And you can do that by focusing on the drug class. So the medication class, like non-steroidal anti-inflammatory drugs, NSAIDs, or narcotics, or ACE inhibitors, or things like that. Then you choose one medication to represent each drug class you have to study. That is your prototype. That's why it's called the prototype method. That one medication is the prototype that you're going to use to represent the rest of the medications in that drug class. It works because the prototype is chosen like you choose a class president. It's a popularity contest. And it's a popularity contest because it's representative of everything else in the drug class. I mean, all the medications are in that drug class because they are similar, because they work similar, they have similar therapeutic effects, they have similar complications and risks. And so if you focus on the medication that's the most popular, the most used, it's going to be the most representative of all the medications in that drug class. It's also going to be the medication that is most commonly tested on, so there's that. But, and here's the kicker, when you get a question on an exam about a medication that is not the prototype, but it is in the same drug class as the prototype, then all you have to do is answer that question as if the medication was the prototype. And like 9 times out of 10, this is going to get you all the information you need in order to correctly answer your exam questions about any medication in that drug class. Now, I always get 1 or 2 trolls on these videos when I talk about the prototype method being like, oh, I would never want to be treated by a nurse like that. Whatever, yes, you would. Like I said, not every nurse knows everything about every medication. The most important skill as a nurse, is to know what questions to ask about a medication when you need to know. And you absolutely 100% get that thinking skill by using the prototype method. Because if you are in practice in the future and you get a medication you've never used, but you know what drug class it is, then you're already thinking, okay, so this medication probably does something like what this drug class does. These are some of the risk factors and complications we're going to be thinking about. And then you can look up any additional details you need to know that are specific to that drug later when you're a nurse. But for now in nursing school, you just need a general foundation of knowledge to be a safe, effective beginning nurse. And one more thing. There will be the occasional medication that is not the prototype for the drug class, but it has something that's like really odd about it or very specific or like a, very specific complication. So if you see a drug like that, go ahead, memorize that because now you only have one medication extra to memorize about one fact because the rest of that drug operates pretty much the same as the prototype. And you just have to also remember that this drug is associated with, this lab test or this complication. And those kind of facts will pop up in lecture, like your professor will emphasize it, or it'll be like a call out box in the textbook or something like that. But memorizing that one fact about one drug other than the prototype is a way better than trying to think you have to memorize everything about every drug in every drug class, because that's just unrealistic in nursing school. Give me a follow if you would like some more practical and helpful nursing school tips that take into account that you're a real person with a real life.